If you're over 55 and struggling with back pain, whether it's morning stiffness, lower back tightness, or that dull ache that makes it hard to stand up straight, you are definitely not alone. Millions of older adults deal with back pain every single day, and for many, it slowly becomes a normal part of life. But here's the truth. Back pain is not an inevitable part of aging. And today, I'm going to show you a simple, senior-friendly stretch routine you can do in just 5 minutes that may help reduce stiffness, loosen tight muscles, and make your back feel easier, lighter, and more supported. This routine is gentle, it's safe, it requires no equipment, and you can do most of it right at home. But before we begin, let's quickly talk about why so many older adults experience back pain and how just a little bit of daily movement can make a surprisingly big difference. Why back pain happens more after 55. As we get older, a few natural changes happen inside the body. 1. Muscles around the spine get weaker, especially the deep core muscles that help hold you upright. When they weaken, the back muscles work harder, and that leads to fatigue, tightness, and pain. 2. The spine loses flexibility. The discs in the spine naturally dry out with age. This makes your back feel stiffer, especially first thing in the morning. 3. Long periods of sitting make things worse. Most seniors spend more time sitting, watching TV, reading, driving, or resting. The longer we sit, the tighter the hips and lower back muscles become. 4. Stress and poor sleep add to the problem. Stress makes muscles tense. Poor sleep reduces the body's ability to repair them. But here's the good news. Even with all these changes, a few minutes of the right movements can help relax tight muscles, improve circulation to the spine, and reduce pain. That's what we're about to do, step by step, slowly and safely. Before we start the 5-minute routine, before we begin the stretches, here are a few safety reminders. Move slowly, at your own pace. Stop immediately if you feel sharp pain. Use a chair or wall for support if needed, and breathe deep, calm, gentle breaths. This routine is not about forcing anything. It's about creating ease, mobility, and relief. All right, let's begin with the first stretch. Stretch 1, the pelvic tilt, gentle spine warm-up. You can do this on a mat, on your bed, or even standing with support. How to do it? Place your hands on your hips or lower abdomen. Slowly roll your pelvis forward, then slowly roll it backward. Keep the movement small and gentle. Repeat for 20 to 30 seconds. Why it helps? This movement improves mobility in the lower spine and wakes up the deep core muscles that protect your back. Many seniors say this alone reduces stiffness first thing in the morning. Stretch 2, knee to chest release. Lower back decompression. Now we'll move into a simple but powerful stretch that gently releases pressure from the lower back. You can do this lying on your bed or on a mat. If getting on the floor is difficult, don't worry, the bed works perfectly. How to do it? Lying on your back, slowly bring one knee toward your chest. Wrap your hands gently around your shin. Don't pull, just hold the position and breathe. After 10 to 15 seconds, switch to the other leg. If comfortable, you can bring both knees to your chest for a deeper release. Why it helps? This stretch opens up the lower spine, relaxes overactive muscles, and helps relieve the tightness caused by long sitting periods. It also gently stretches the glutes and hips, which are often a hidden cause of back pain in adults over 55. Stretch 3, seated cat-cow. Spine mobility for seniors. If you're someone who finds floor exercises difficult, this one is perfect for you. All you need is a sturdy chair. How to do it? Sit tall, feet flat on the floor. Place your hands on your knees. As you inhale, arch your back slightly and lift your chest. This is the cow position. As you exhale, round your back gently and tuck your chin. This is the cat position. Move slowly between these two positions for 20 to 30 seconds. Why it helps? This movement improves flexibility along your entire spine, from the neck all the way down to the lower back. It also increases blood flow to stiff areas, which is key for pain reduction and mobility in aging bodies. Many seniors notice immediate relief with this one. Stretch 4. Hip flexor opener, the forgotten stretch for back pain. Most people don't realize that tight hips, specifically tight hip flexors, are one of the biggest causes of lower back pain in older adults. When we sit for long periods, these muscles shorten, and when they shorten, they pull on the lower back. This stretch helps fix that. Standing version. Stand near a wall or chair for balance. Take a small step forward with one foot. Gently bend your front knee while keeping your back leg straight. You should feel a gentle stretch in the front of your back thigh. Hold for 15 seconds, then switch sides. Chair version for easier support. Stand behind a chair and place your hands on the backrest. Step one foot back slightly. Lean forward just enough to feel the stretch. Hold 15 seconds, then switch. Why it helps: this stretch opens up the hips and removes pressure from the lower spine. When the hips loosen, the back can relax, reducing pain and improving posture immediately.
Stretch 5. The gentle twist, releasing tension along the spine. This next movement is one of the most soothing stretches for seniors because it helps relax the muscles along the entire back, especially the lower and mid-spine. You can do it seated or lying down. I'll show you both. Seated version. Sit upright in a chair. Place your right hand on your left knee. Gently rotate your upper body to the left. Keep your shoulders relaxed. Hold for 10 seconds and breathe slowly. Switch sides. Lying version, if comfortable. Lie on your back. Bend your knees and keep your feet flat. Gently drop both knees to one side. Stretch your arms out wide. Hold 10 to 15 seconds. Switch sides. Why it helps? This twist releases tightness in the lower back, improves spinal mobility, and increases blood flow to stiff muscles. Many older adults describe this as instantly relaxing. Stretch 6. Supported forward fold, hamstring and back relief. Hamstrings, the muscles behind the thighs, often get shorter with age. When they tighten, they pull on the pelvis, which pulls on the lower back, which increases pain. This stretch helps gently loosen those hamstrings without bending too far. How to do it? Seated version. Sit at the edge of your chair. Extend one leg straight in front of you, heel on the floor. Keep your back straight and hinge forward slightly from the hips. Only go as far as comfortable. Even a small lean helps. Hold for 15 seconds, then switch legs. Why it helps? This reduces tension that pulls on your lower spine, helping you stand straighter and move more comfortably throughout the day. Stretch 7. Back strengthener, the wall angel. Now that we've loosened the muscles, we finish with a simple strengthening movement. It helps improve posture, which is one of the biggest contributors to back pain for seniors. How to do it? Stand with your back against a wall. Place your feet a few inches forward. Press your lower back gently against the wall. Raise your arms slowly, like making a snow angel. Go only as high as comfortable, then lower. Repeat for 20 seconds. Why it helps? This activates the upper back, shoulders, core, and postural muscles. Strengthening these muscles makes it easier to stand up straight and reduces pressure on the lower spine. Transition. Now let's talk about foods that secretly harm aging bodies. Now that your back already feels looser and more open, remember this: movement fixes the outside, but food fixes the inside. Many seniors don't realize that some everyday foods, things we grew up eating, can silently increase inflammation, weaken muscles, stiffen joints, or make back pain worse. So, next, I want to share the common foods that quietly damage aging bodies and what you should eat instead to stay strong, mobile, and pain-free. We'll go through them one by one. Foods that silently damage aging bodies and healthy swaps. Now that your muscles are warm and your back feels more open, let's talk about something just as important to stretching, your daily food choices. Because here's the truth, inflammation starts in the gut, and your back often feels it first. Certain foods create more stiffness, swelling, and discomfort in the body, especially for adults over 55. But the good news is, with a few simple swaps, you can support your joints, reduce inflammation, protect your spine, and improve your energy every day. Let's go through the most common hidden culprits. Food number 1, refined sugars. Cakes, biscuits, pastries, sweetened tea, packaged desserts. Sugar is one of the biggest drivers of inflammation in older adults. It causes blood sugar spikes, increases joint stiffness, and even weakens muscles over time. Many seniors say things like, "Whenever I eat sweets, my back and knees hurt more the next morning." That's not your imagination, it's inflammation. What to eat instead? Fresh fruits like berries, apples, and pears, a small spoon of honey, nuts when craving something sweet. These options give you sweetness without the inflammation. Food number 2, processed meats. Hot dogs, sausages, ham, deli meats. Processed meats contain preservatives and chemicals that can irritate the body, raise inflammation, and increase stiffness. They also contain high sodium, which raises blood pressure, something many seniors are already managing. What to eat instead? Fresh chicken, fresh fish, beans or lentils, home-cooked lean meats. These give you protein that support your muscles without irritating your joints. Food number 3, white flour products. White bread, white pasta, white rice, crackers. Foods made from refined white flour break down quickly into sugar in the body. This contributes to weight gain, bloating, joint pain, and even more back pressure. What to eat instead? Whole grain bread, brown rice, whole wheat pasta, oats, quinoa. These healthier carbs give you energy without the inflammatory spike. Food number 4, vegetable oils. Sunflower oil, corn oil, soybean oil, canola oil. Many people use these oils every day without realizing they can trigger inflammation. They're high in omega-6 fatty acids, which push the body into inflammatory mode. What to use instead? Olive oil, the best choice. Avocado oil, small amounts of butter, coconut oil for cooking. These oils support your joints, heart, and overall mobility. Food number 5, too much salt. Chips, packaged soups, frozen meals, salty snacks. Host, gentle concern. Salt is necessary, but too much of it can cause swelling, stiffness, and increased pressure in the joints and lower back. As we age, our kidneys become less efficient, so excess salt stays in the body longer, leading to bloating and inflammation. Many seniors notice this especially in their fingers, ankles, lower back, knees. What to do instead? Choose low-sodium products. Swap salty snacks for nuts or fruit. Season with herbs like garlic, rosemary, turmeric, or paprika. Drink more water to flush extra salt. These changes help reduce stiffness and improve overall mobility. Food number 6, fried foods. Fried chicken, French fries, samosas, battered foods. Fried foods are difficult for aging digestive systems to process. They produce inflammation, slow digestion, and increase pressure on your spine by contributing to weight gain. And the oils used for frying, they're usually the same inflammatory vegetable oils we mentioned earlier. What to eat instead? Air-fried versions, oven-baked alternatives, grilled or steamed foods. You still get flavor without the joint pain. Food number 7, artificial sweeteners.
diet sodas, sugar-free desserts, low-calorie syrups. Many seniors switch to sugar-free products thinking they're healthier, but artificial sweeteners can disrupt gut bacteria, and a healthy gut is essential for reducing inflammation. When the gut is irritated, joints become inflamed, back pain increases, and energy drops. Better choices? Stevia, raw honey, fruit-sweetened snacks. These options are easier on your digestive system and better for overall mobility. Food number 8, too little protein. This one surprises many seniors. It's not a food that harms you, it's the lack of it. After 55, the body loses muscle faster due to natural aging. Without enough protein, muscles become weaker, and when the back muscles weaken, pain increases. Signs you may not be eating enough protein? Feeling weak, slow recovery, more back or knee pain, low energy, difficulty standing or walking for long. How to fix it? Aim for protein at every meal, especially eggs, yogurt, chicken or fish, beans and lentils, tofu, nuts and seeds. Even small increases make a big difference in strength and pain relief.
Part 6. Foods that help rebuild, protect, and relieve back pain after 55. Intro. Food as medicine for aging bodies. Now let's shift to the good news. Because while some foods increase pain and stiffness, others actively help your body heal, supporting your spine, muscles, joints, and even your posture. These foods don't work overnight, but when eaten consistently, they help reduce inflammation, strengthen muscles, protect bones, and keep your back moving more comfortably. Let's go through the most powerful ones. Food number 1. Omega-3 rich foods, natural anti-inflammatories. Omega-3 fats help calm inflammation throughout the body. They're especially helpful for seniors with back pain, arthritis, or stiffness. Best sources for seniors: fatty fish like salmon, sardines, and mackerel, walnuts, flax seeds, chia seeds. Studies show omega-3s can reduce joint pain and stiffness, especially when combined with gentle movement. Food number 2. Leafy greens, bone and muscle support. Spinach, kale, Swiss chard. Leafy greens are rich in magnesium, calcium, and vitamin K, all essential for bone strength and muscle function. Low magnesium levels are linked to muscle cramps, spasms, and chronic back tightness in older adults. Simple ways to add them: toss into soups, add to omelets, blend into smoothies. Small servings daily go a long way. Food number 3. Berries, pain-fighting antioxidants. Berries are loaded with antioxidants that fight inflammation and protect aging cells. They're gentle on digestion and easy to add to any meal. Best options are blueberries, strawberries, and blackberries. A small bowl a few times a week can support joint comfort and recovery. Food number 4. Eggs, muscle repair and strength. Eggs are one of the best foods for seniors. They contain high-quality protein, vitamin D, and leucine, all essential for muscle repair and strength. Strong muscles equals better posture equals less pressure on your back. Aim for 1 egg daily unless your doctor advises otherwise. Food number 5. Turmeric and ginger, natural pain relief. These 2 spices have been used for centuries to reduce inflammation. Turmeric contains curcumin, which helps calm joint pain. Ginger improves circulation and reduces stiffness. How to use them: add to soups, brew as ghee, sprinkle on vegetables. Many seniors report less stiffness within weeks of regular use. Setting realistic expectations. These foods won't replace medical care, but they do support your body's natural healing process. When combined with the 5-minute stretch routine you just learned, they can help you feel stronger, more flexible, and more confident in your movement.
Putting it all together and final message: the simple daily routine for a stronger, pain-free back after 55. Let's bring everything together into a simple daily plan you can realistically follow. No stress, no pressure. Step 1. 5 minutes of gentle movement once a day. Use the stretches you learned today. pelvic tilt, knee to chest, seated cat-cow, hip flexor stretch, gentle twist, hamstring stretch, wall angels. You don't need to do them perfectly, you just need to do them consistently. Even 5 minutes tells your body it's safe to move again. Step 2. Eat to reduce inflammation, not feed it. Remember this simple rule. If it comes in a package, question it. If it comes from nature, trust it more. Focus on lean protein at every meal, healthy fats like olive oil, colorful vegetables, berries a few times a week, and enough water daily. Your back doesn't heal only through stretching, it heals through nourishment. Step 3. Support your body, don't fight it. Aging doesn't mean giving up movement, it means moving smarter. Pain is not always damage, often it's stiffness, weakness, or inflammation asking for attention, and today you gave your body that attention. Who should do this routine? This routine is ideal if you are over 55, have stiff or sore lower back, sit for long periods, wake up with back pain, want to avoid surgery or heavy medication, want to stay independent and active. Final encouragement. Your body is still capable of healing. Your muscles still respond to care. Your spine still benefits from movement. It's never too late to feel better. If this video helped you, please give it a like. It helps other seniors find this information too. And consider subscribing for more gentle routines, natural health tips, and aging well guidance. Take care of your body. It's the only one you have, and it's still working hard for you.